Hey, if you're new to my channel, I'm Dr. Tony Hampton, your metabolic health doc. And today we're diving into a surprisingly overlooked topic, salt. Yes, that mineral that most doctors tell you to avoid. But if you're on a carnivore or low-carb diet and still feeling off, headaches, fatigue, dizziness, maybe even constipation, this might be the missing mineral. And guess what? I had to learn this one the hard way myself. I thought I was doing everything right, eating the meat, skipping the sugar, and then I hit a wall. And all signs pointed to something I never thought to question, how much salt I was actually getting. So today, we're unpacking it all. What salt really does, what happens when you don't get enough, and how to salt load the right way. And yes, how to avoid doing it wrong. And hang in there because this one might just save your carnivore journey. Now let me confess, I didn't always know what I'm about to share with you. I mean, I'm a doctor. I knew salt was important, but I didn't really understand how much more important it becomes when you go low carb or carnivore. Like many of you, I wanted to sprinkle some pink Himalayan salt on my steak and call it a day. But I didn't realize that the same metabolic shifts that make low carb powerful, like lower insulin and ketone production, also make your kidneys dump sodium like it's going out of style. No carbs, no insulin, no sodium retention. So I started studying, experimenting, and of course, testing this out with my patients. And what I found shocked me. Let's start with the basics. What does salt actually do in the body? Salt, or more specifically sodium, isn't just about flavor. It's about a key electrolyte that helps maintain your blood pressure and blood volume, regulate nerve signals and muscle contraction, balance fluids inside and outside your cells. Now, when you're eating carbs, your body holds on to sodium. Insulin tells your kidneys, hold on to that salt. But when insulin drops, like it does on keto or carnivore, you pee it out. That's why people lose so much water weight at the beginning of keto. But it's not just water, it's sodium loss too. And with that sodium loss comes a whole parade of symptoms people mistake for the flu. Fatigue, low energy, or even worse, they think the diet isn't working. But it's not the meat, it's the missing minerals. So how do you know if you're not getting enough salt? Here are some of the top symptoms I see. Headaches, dizziness or feeling of lightheadedness when standing, fatigue and muscle weakness, constipation, brain fog, heart palpitation, craving salty or fatty foods, low motivation, especially in the gym. So when a patient on carnivore comes to me and says, "Doc, I'm eating clean but I feel terrible," I don't start with fancy labs. I start with salt. And get this, low salt can also mean low stomach acid, which makes it harder to digest meat. So yes, that bloated, heavy feeling, sometimes it's not the ribeye. It's the salt your body needed to digest the ribeye. Now let's have some fun and talk about the mistakes people make when they try to fix this. Mistake number one, under salting. A few pink sprinkles on your food isn't enough when your body's flushing out sodium all day. Mistake number two, overloading all at once. Drinking 2 teaspoons in one sitting like it's a dare. That'll send your gut into panic mode. You need to spread it out. More like sipping, not chugging. Mistake number three, ignoring the other electrolytes. Sodium works best in balance with potassium and magnesium. If one's missing, things get wobbly. Mistake number four, trusting table salt. Refined table salt often contains additives like anti-caking agents. Go for mineral-rich salts like Redmond's, Celtic sea salt, or Himalayan. Mistake number five, fearing salt because of blood pressure myth. Yes, some people with salt-sensitive hypertension need to be careful, but for the majority, especially those on low-carb or carnivore diets, salt is not the enemy. Insulin resistance is. So how do you do this right? Let's break it down. Target intake. Most people on carnivore thrive with 4 to 6 grams of sodium per day. That's about 2 to 2.5 teaspoons of salt total. If you're sweating a lot, working out hard, or in ketosis, you might need more. Start your day with salt water, 1/4 to 1/2 a teaspoon of sodium in warm water. Add lemon if you need a flavor boost. Salt pre-workout or pre-sauna. This can prevent fatigue, dizziness, and cramping. Listen to your cravings. If bacon grease sounds amazing, your body might be telling you it needs salt and fat. Use electrolyte mixes wisely. Element, Redmond, Relight, DIY blend, salt plus potassium plus magnesium, or Keto Chow Salty can help. Avoid sugary sports drinks. They're the fake friends of hydration. Track symptoms. If your energy improves, digestion smooths out, and your brain fog lifts, you're doing it right. All right, let's go deeper. This is where root cause medicine shines. Ever heard of aldosterone? This hormone tells your kidneys whether to keep or dump sodium. Low-carb diets tend to lower insulin and aldosterone, so your body doesn't retain salt well. Now think about adrenal fatigue. Low sodium can worsen fatigue because the adrenals are working overtime to compensate. Even your mental health can take a hit. Sodium helps maintain volume in the brain's interstitial space. Inadequate sodium, think fog, anxiety, even depression. If you're someone with histamine intolerance, low electrolytes can worsen symptoms because your detox pathways get sluggish. So again, this is not just about hydration. It's about electrical balance, hormone support, gut function, mood regulation, and metabolic health. Here's the bottom line. Salt is not just a seasoning. On a carnivore diet, it's your power tool. Get it right and your body runs like a well-oiled machine. Get it wrong and you'll feel like your battery's dying, no matter how clean your diet is. So try the salt water, test your dose, and most importantly, listen to your body. You don't need to fear salt, you need to understand it. And if this video opened your eyes, let me know in the comments. Have you been salting enough? And be sure to like, subscribe, and hit that bell so you don't miss what's coming next. And if you want to go deeper into carnivore strategies, check out the playlist in the description below. Because sometimes the fix isn't in another supplement, it's already in your kitchen. Stay salty, my friends, and stay healthy.